Tell us about treatment burden, what it is and why it matters.
Yeah, so I guess it's a relatively recent concept. It's really the workload required of patients to look after their health, and also the impact that that has on them. Broadly speaking, treatment burden for the whole group tended to get a little bit worse. The categories of treatment burden, so whether people had no treatment burden, low treatment burden, medium or high treatment burden, and about just under half stayed in the same category that they were in at baseline, so 2.5 years previously. About a third increased, and about a fifth decreased. Among those people whose treatment burden increased, they were more likely to be older, they were more likely to have more long-term conditions and more medications, as you might expect, and they were more likely to be ex-smokers. When we looked more closely at the associations with the increase in treatment burden, the two main variables that remained associated with an increased treatment burden were having more than 5 long-term conditions and living 10 or more minutes away from the GP, which is quite interesting given that this was in a sort of post-pandemic context when consultation has changed. The other important finding was that there was a varied association depending whether you had limited health literacy or not. So there was a stronger association of increased burden with living more than 10 minutes away if you had low health literacy. We need to do more in the area of treatment burden and understanding its drivers, particularly for people with multiple conditions, and think about the way that we structure general practice and the way that we work to help people manage everything they have to do.